All right, so in this lecture, we're going to go over some just standard definitions, and by no means is this entire slide right here all inclusive. There's going to be more concepts that we're going to have to address at different times, but I figured that these are the most foundational principles that you need to understand. So when I refer to a traditional versus a non-traditional applicant, this course is obviously designed for non-traditional applicants, and what I'm referring to by a definitional standpoint is someone who did not go through a standard pre-medical track in college. So anyone who's basically outside of that pre-med coaching series is pretty much considered a non-traditional applicant, or someone who takes more gap years than what is typically expected, which is about one gap year. So non-traditionals could be anyone from different healthcare professions, like a nurse or a pharmacist or a physical therapist or even a PA. Who decides to go back to medical school, or it could be someone who's just not in the healthcare field at all, musicians and so on, or someone who's just in the healthcare field but decided to go back to medical school many years later. So because of that non-traditional status, we don't have access to pre-medical counseling, to a lot of the resources that basically, essentially what you're paying for in a pre-medical course is that the consulting fee to get into medical school. They kind of coach you along the ways. They set you up with resources and opportunities that can better your application. So as a non-traditional, like yourself, you can obviously understand that it's a little bit harder, and hence why you're here in this course in the first place. So we have some definitions on what constitutes a competitive applicant. We'll get into the details a little bit more in the next couple lectures, but generally speaking, a high MCAT score is important. As well as a high science GPA, as you can see, greater than 3.7 SGPA, also known as a BCPM, and that stands for biochemistry, physics, and math. So those are, traditionally speaking, the more challenging courses, and because of that, they awarded a better weight than just a total GPA. And that makes sense. You want your medical school applicants to have a strong background in, the sciences and whatnot. So I mentioned the MCAT as well. So the MCAT is probably the cornerstone of a medical school student's application. It is the most important test that you will actually take probably in your career, and it is so important to getting into medical school. So having a good score and not taking it multiple times can really help bolster your application. So very, very essential that we have like a whole lecture series just on that alone. The Casper and Alta Suite, like I said in the introduction video, these are newer components to the medical school application cycle. So when you see the word Casper, think of it as an ethics exam. And Alta Suite is basically the Casper plus Duet and Snapshot, which are newer components that kind of focus on getting a applicant's like personality and matching it to a medical school. We'll cover all of that in future lectures, but I just want to introduce those concepts now. Letters of recommendation are obviously very important for medical school applications. So you may hear me referencing Interfolio. That is a third-party resource that basically allows you to confidentially upload letters, or have your letter writers upload the written contracts that you have, and distribute them out to the different medical school application platforms, which includes AMCAS and ACOMAS. AMCAS, which is right here, the primary application is AMCAS, and it's also ACOMAS for osteopathic. So we'll have more information on that, so don't get tripped up on some of the terminology there. So when you hear AMCAS, think primary application. When you hear ACOMAS, you think primary application, but osteopathic. Secondaries are just basically second options or second lectures and prompts that you are given to then respond to from individual medical schools. So any medical school you apply to will most likely send you a secondary application that is specific to that university. So if a medical school A sends, a secondary, like 5 or 6 secondary prompts, some of which will include prompts like, why do you want to go to our medical school? Tell me a time that you faced a challenge, and so on. And so we'll cover that. Interviews are pretty straightforward, but there are many different types of interviews that you might not be aware of outside of the traditional interview. And that would include like mini multiple interviews as well as group interviews, and we'll talk about strategies to perform well with those. There's also transcripts and prerequisites. That's pretty self-explanatory there. Gap years refer to anyone who is basically not a traditional applicant, so anyone who doesn't complete anyone who completes 4 years of school and then decides to not apply to medical school outright will then take a gap year in which they're not receiving any formal education at that time. The rates of gap years are increasing just because it's getting harder and harder to get into medical school just through doing 4 years, because as more and more people do gap years, they're getting more and more experience, which leads to better and stronger applications, which then crowds out the people who don't take gap years. So it's kind of a self-fulfilling prophecy with some regard to that. So, and then the last but not least term that I'd like to cover is the MSAR, and that is the comprehensive database that includes all of the medical schools in I guess, the continental U.S. as well as internationally. And that is specific to MD schools. And that provides information about the medical mission, the average stats, and so on for that institution. And we have a whole lecture series on that as well. But that is a paid service. You pay like $20 or something along those lines, and then they will give you access to all of the resources to apply. There's this new option for osteopathic schools called Choose DO or DO Explorer, which basically serves as the exact same thing. Okay, so now that we've covered some definitions, we can advance on to the next steps.